therapies to the marketplace. We have funded a company that's based in Auburndale, Massachusetts. I want to say life sciences going on all around the state of Massachusetts, to continue their development of a biologic immunotherapy that uses a tumor-specific vaccine to fight the recurrence of cancer. And Advantage is currently in phase 3 clinical trials. That means really close now to bringing this to market for the vaccine that is targeted to prostate cancer. So I think we can expect to see this on the market, we hope, in the very foreseeable future. And because of Massachusetts' commitment to the life sciences, the governor's commitment, the legislators' commitment, companies from all around the world, the giants in oncology, Pfizer, Novartis, Sanofi, H3 Biomedicine, are joining our efforts in expanding their presence here in Massachusetts. So like all of you, I look forward to the day when we will no longer need a Prostate Cancer Awareness Day. But until that day comes, please know that the Life Sciences Center and the Commonwealth of Massachusetts are working to fund the best research that's going on here in our wonderful and talented life sciences community. We are putting infrastructure in place to help us move closer to that goal. And with our sincerest thanks to the governor and to the legislature for their continued support, we are going to continue that work. Thank you.
And now I would like to introduce to you Tom Farrington, founder of the Prostate Health Education Network.
Good afternoon, everyone. It is a great day today, Massachusetts Prostate Cancer Awareness Day. You know, it's good to be a resident of a state that takes the lead. And with Dr. Stern's advocacy, it is wonderful for Massachusetts to have a Prostate Cancer Awareness Day. I'm a 12-year prostate cancer survivor, and when I was diagnosed and treated 12 years ago, I released my first book, Battling the Killer Within, in the year 2001. Prostate cancer back then was truly a silent disease. You know, to have men come out and talk about it, and to have this type of support throughout the leadership within the state just was not here. So to see it all happening before me over that time is a tremendous, tremendous achievement, and it's beautiful, Dr. Stern. Now, also, I want to talk about our leadership in the Senate. Senator John Kerry, I remember when Senator Kerry was diagnosed with prostate cancer. We talked, he received a copy of my book, and after reading it, he told me that he did not realize that African-American men were impacted as we are with prostate cancer. And he pledged to do what he could to help with that issue. In 2005, I went to Senator Kerry and I asked him to help me host an African-American Prostate Cancer Disparity Summit. And in the year 2005, we hosted the first ever African-American Prostate Cancer Disparity Summit in the Raven House office building. This year will be our 8th summit. We now hold one day at the U.S. Capitol building and the other day at the Washington Convention Center. What we have to do to really achieve our goals of eliminating this disease, and especially eliminating the disparity, there's a lot of blocking and tackling that has to happen at every level. And so with the leadership at the top, as we work ourselves down on the ground level, at the grassroots level, they like to say, we need to make an impact there. This year, we hosted our 4th annual Father's Day rally in churches across the country. And we had hundreds of churches nationwide where we tried to reach men and women with the message about early detection. Also, the importance of treating advanced prostate cancer. We sometimes forget that issue, but there are probably 2 million men living with advanced prostate cancer, and that again, there's a disparity for black men at that level. So there are a lot of new treatments that are now coming, that are being developed for advanced prostate cancer that we have to be on top of that as well. So with the blocking and the tackling and the work at the local levels, at the grassroots level, along with the awareness that we have here today, 10 years out, I think we really will make a tremendous impact on eliminating prostate cancer as a disease that is the second leading cause of cancer death among men. Thank you, Dr. Strand, for your leadership on this effort.
And now I would like to introduce to you Bo Stubblefield-Tave, a prostate cancer survivor and principal of the Center for Culturally Fluent Leadership. Thank you.
I've been in the State House many times because I came to Boston to head up the healthcare policy department for Harvard Pilgrim Healthcare. But this is my first time getting to speak, and I couldn't think of a better topic, and certainly not a better day to speak on. As you heard, I am a prostate cancer survivor. I'm a 3.5-year survivor. Hope to make it to where Tom is someday. Thank you. But that is not the first way cancer affected my life. I think one of the most important things for us all to realize, as has been said before, is that cancer is a personal struggle, it's a family affair, and it's a community crisis. My sister Barbie died in 1987 of breast cancer. She was 34 years old. Okay. That's tragic, obviously. You know, when I think about what's happened since I turned 34, well, both of my kids have been born, and they're now 21 and about to be 18. I've had 21 years of life that she never had. But she also had 5 years of life after she was diagnosed, because that was the available technology that was there then. We have a chance to bring the kind of technology that we have now in breast cancer to prostate cancer, and that's very exciting for me. I am going to focus on prostate cancer, but this is the day of the Affordable Care Act being supported, and I have to touch on that because I've been in healthcare for 32 years, and there's never been a day like this in my life. I used to talk with folks in Canada, and they said, oh yes, America, that's that country where owning a gun is a right and healthcare is a privilege. It's not that way anymore. But we know, as Maya Angelou would say, it's about how far we've come, but also how far we have to go. All of our brothers and sisters who are undocumented will not be covered because of the ACA. And just because you have insurance coverage doesn't mean you're going to get the care that you need. And all that affects prostate cancer. Thank you. So let me go to the prepared remarks now. Of all the forms of inequality, injustice in health care is the most shocking and inhumane. Dr. King's words are just as true today as they were 40 years ago when he said them. Black men in Massachusetts and in the US die of prostate cancer at twice the rate of other men. Our demographics are not our destiny, however. I speak to you today as a survivor because I had timely screening, coordinated care, and support from my family and community. By taking action now, I believe we can save lives and save dollars simultaneously. So please take my story as a guide. Timely screening is essential. Beginning at 40 years old, all men at high risk should get a PSA test. No ifs, no ands, no buts. Everyone should get that test. That high-risk group includes all black men, all African descendants, whether you're African American, from the Caribbean, from Africa itself, it doesn't matter. If you have one drop of black blood, you should receive the test at 40. It also includes anyone who has a family history of prostate cancer. Now, in my case, I didn't have a family history. My dad is living with prostate cancer, but he got his in his 80s, okay? He's much smarter than I am. I got mine in my 50s. But you only know if you have both tests, because as you've heard earlier, both the PSA test and the digital rectal exam can find the cancer. One or the other is not sufficient. Once I had my diagnosis, once I heard those words, it's cancer, I had coordinated care through Harvard Vanguard Healthcare. My team helped me consider all of my treatment options in and outside of my insurance network. And I chose robotic surgery with Dr. Ingolf Turk, a physician who trained in Berlin, actually, so he's an immigrant, yes, and he saved my life. My regular urologist supported that and supports my cancer to this day. I had the freedom to choose where to go for cancer, and I chose a community teaching hospital, much less expensive than the Dana-Farber's and the Brigham and Women's, which are all wonderful hospitals. So I saved the system money, but I had the choice of where to go. And I chose not on the basis of dollars, because my copay was going to be the same, but on the basis of where it was best for my care. I believe everyone should be able to make that choice, this critical choice in terms of your life treatment, based on what's best for you, not based on dollars. Finally, family and community support. We've heard about stigma. Stigma is deadly in prostate cancer. Many men avoid screening and treatment because of the stigma that still exists in all communities, certainly in the Black community. I have to say personally, and I'm sort of embarrassed to say this, that yes, from my first high PSA to my second, I delayed a year, partially because I didn't want to hear that news, that it might be high. But once I got the second one, I went in, I got my biopsy, and my biopsy was clear. Then I spent a couple of years not getting repeat biopsies, even though I knew better. But fortunately, my physician assistant found out I had missed some biopsies and said, you need to get back in. I went back in, I got repeated biopsy. It was on my 5th biopsy that we found out I had cancer. Because we found it so early, it was microscopic, I had good treatment. That screening, that treatment saved my life. I'm going to encourage all of us to think about a campaign that reduces stigma. The Boston Public Health Commission created Pink and Black campaign, ambassadors of Black women who've experienced breast cancer. What if we created a Blue and Black campaign of Black men survivors of prostate cancer who let all men know, and Black men in particular, that strong men can beat this silent killer? Thank you for your time and all you do to improve the health of us individually, as families, and as communities. Thank you very much.
What a great day this has been. I know that I've learned a lot. I've been impacted. I've been moved. No longer, after days like today, will this be a silent killer, because we're learning information and we're not going to be silent anymore. It's my privilege and honor again to bring to the podium Dr. Stern.
Really, once again, we've talked a lot about recommendations of the Preventive Services Task Force that, in fact, in my judgment, in Dr. Kantov's judgment, and Dr. Kaibel's judgment that we all expressed very clearly, in fact, is going to jeopardize men's lives. And it was all over the media. The recommendations of this panel was all over the media. I cannot thank David enough for being here today and being the first media person willing to listen to a different message. So let's give him a hand. And if I learn anything about David and the history of his life, what he just said about not keeping silence about the correct facts of prostate cancer is not going to be left in this room. I would like to complete this event. First of all, by recognizing a person who could not join us early.